Have you ever experienced sudden, intense joint pain that leaves you wondering if this is gout? As a rheumatologist with years of experience, treating thousands of patients with gout in my practice Rheumatologist OnCall, I am here to guide you through the process of diagnosing gout and help you determine if your joint pain is a result of this painful condition.
Rheumatologistoncall.com.
Before diving into the diagnosis process, it is crucial to understand what gout is. Gout is a form of inflammatory arthritis which is caused by the buildup of uric acid crystals in the joints. It typically affects the big toe, but it can also happen in other joints like your ankles, knees, and fingers. High levels of uric acid in the blood is also known as hyperuricemia, and that can lead to the formation of these painful crystals. When a patient visits me in my practice, Rheumatologist OnCall, I start with a very thorough assessment. This will include a detailed medical history, a physical examination, and a discussion of their symptoms. I often ask questions like, did the pain in your joint begin suddenly and it became severe within a few hours? Is the affected joint swollen, red, and warm to touch? Have you ever experienced similar joint pain in the past? If you haven't seen it already, check out my video about 5 signs of gout for more information on gout symptoms. If I suspect gout based on the patient's history and symptoms, I do order several laboratory tests and imaging studies to confirm the diagnosis. These may include blood tests, a blood test that can measure the level of uric acid in your blood, which in gout patients could be high, but not always. I will check the kidneys, the liver function, the cell counts, and the hemoglobin A1C, because many patients with gout can have associated diabetes or associated kidney issues. If the patient has a swollen joint, then I will do a synovial fluid analysis, which is a sample of fluid that I take from the affected joint using a needle. Then I put the fluid under a microscope to look for uric acid crystals, which have a very specific appearance under the microscope. Then I might perform x-rays, ultrasounds, or I will ask for a CT scan. This imaging study will help me visualize how the gout affected the joint, and I can differentiate between gout and other diseases. Now, let me give you an example. If I have a patient with multiple joints involved, then at that point, I will make sure that the patient doesn't have another disease, for example, rheumatoid arthritis or psoriatic arthritis. And by the way, it is very common that patients with psoriasis to develop gout or patients with psoriatic arthritis to be confused as gout. One of the latest diagnostic methods for gout is a CT dual energy, which is a cutting-edge imaging technique that can identify uric acid deposits in the joints. This is non-invasive and provides a more accurate and detailed view of the affected joints and will help me confirm the gout diagnosis in patients where I'm not sure if they have or they don't have gout. The CT dual energy will show the crystals of uric acid in a specific type of color and will differentiate from other types of crystals. A definitive gout diagnosis is typically made when uric acid crystals are seen in the synovial fluid or when specific symptoms accompanied by elevated blood uric acid levels and with positive imaging results. However, it is essential to remember that only a physician can accurately diagnose you with gout. In my experience, treating patients with gout, understanding the impact of diet on this condition is also crucial. If you haven't seen it already, be sure to watch my video on the best and worst foods for gout and learn about very useful information regarding a diet that is useful for gout patients. Now, thank you for watching this video on how to diagnose gout from a rheumatologist perspective. I hope you find it informative, and if you have any questions or experiences that you would like to share, please leave them in the comments below. I would love to hear them, and I love your engagement because it helps me create better content. Don't forget to subscribe to my channel for more videos on gout and other types of arthritis. See you soon in my next video.
Rheumatologist OnCall.com.